You're on.
I'm
Great.
on. Okay, great. So thank you all for joining and also for answering those two questions. Definitely interesting that there was some difference between the two. And last guy, did most everyone respond, or that percentages about how many people responded? I'm curious.
Just give me a second to check. 62% voted for the first one.
Yeah.
And for the question one, 66% voted.
Okay. So super interesting. And I think I'm, calling in from Denmark, as Laska mentioned. And what's been interesting here is that actually the city, streets and spaces and public life have been pretty active part of the country's response to the pandemic. So I think there's been a national support to be outside, get exercise and fresh air, meet people, but do so responsibly and by following physical distancing rules. And I think that is very interesting to ponder, maybe something we'll talk about later, how the Danish approach might be similar or different to other countries. But for me, of course, working as an urban designer, I feel like right now, our built environment, our neighborhoods, our streets, and our spaces are actually one of the best tools that we have to deal with this pandemic and deal with our health, because we don't have a virus, a vaccine or a pill that we can take, right? So the best thing that we can do, also to Mons's point, is take good care of ourselves. And so it'd be interesting to see how we can promote that, and not fall into the trap that that Mons was saying. But I'm sure I'm preaching to the converted here in terms of all of you guys feeling that way. But hopefully what I want to do in my presentation is give you some concrete data and insights into hopefully how you might be able to make that argument for using public life in the response to COVID and beyond in your city and country. So very quickly, Laska gave a nice overview of our company. The key is that we work quite globally and have studied public life, how people use streets and spaces in many different climates, many different socioeconomic background conditions, and have gathered a lot of input on trying to solve this question about how do we make what is good for you, how do we design for that? So the easy thing is the healthy choice, right? So the easy choice is the healthy one. So designing for our cities and spaces for health and well-being for you as an individual, but also when you use the city, it should also be good for the collective. Easier said than done. As a designer and in the design community, we have to also, think back to 20 years ago, where we're still living with design choices that were made after 9/11. You all have lived through very painful experiences at airports. A lot of these decisions to implement this type of airport security was made very quickly after 9/11, and so I think now the time is actually urgent for us to provide a comfortable, high quality alternative to living with the pandemic, living with physical distancing, that's hopefully much more human centered than some of these early responses were. The same could also be said for subsequent terrorist attacks in Europe and beyond, where our cities are now filled with physical barriers like this, not the best design solution to supposedly sort of protect us from terror. So if we know that the stakes are high, when big things happen, like pandemics or wars, we have to actually choose very wisely how to deal with them. And for us, the key to making those decisions is actually having data, having real life evidence about what's going on. That's these areas in the red here, knowing what's happening while cities are in lockdown. Also then collecting data again about what's going on as they reopen, and then using that information to also hopefully inform longer term strategies. So that's what we've been doing in our work, is getting pre and post corona data digitally through partners like Maps and Air, who you all might be familiar with, asking people about how they use the city before and during, also doing questionnaires like this one here, which we sent out to the whole world and got a couple thousand responses. And some of the results will also be especially interesting for this group. So we asked these 2,000 participants if they've used public space during the pandemic, and not that much different of a response than what you all said. They've used the space a bit more than you all did, but still really, I think, something to ponder about why that might be, right? Because in some cases, it could be because they were closed, or it could, in a lot of cases, be because people don't feel safe. And of course, what you see here also in response to this survey is that it is the very, very essential spaces. It's our neighborhood streets and sidewalks. It's the local neighborhood park. It's these very local areas that we might have taken for granted before, that now all of a sudden became really vital to our sort of mental and physical well-being during the pandemic, but also places where a lot of crowding took place, where people simply felt like it wasn't safe to use those everyday places. The top reasons to use public space of these 2,000 respondees was definitely about exercise, followed by relaxation. And I think it's interesting to think about this. You know, typically we'd say the inverse happens in everyday life, right? Most of us, we commute, we run errands, we do all these things we have to do in the city. And the pandemic really turned that upside down, right? So now all of a sudden, if we did go out, we did so for the things that we love to do, like exercise, meet people, get fresh air, and relax. We also saw that actually older people felt especially maybe both empowered or emboldened to use the public realm as for social activity, which I think is interesting, given that, of course, we know elderly were like more in the risk area. And also, I think actually gave an opportunity for a lot of people living alone to, ironically, in at least what we found, feel a little bit more connected. So people that typically feel isolated are especially using the public realm. And also, we actually saw a time now, this new normal of a lot more walking and cycling, a lot less driving, and of course, a lot less transportation. So one question, of course, is, well, how do we continue on some of these trends? How do we ensure that people that are otherwise isolated can connect? How do we use healthier forms of transportation? How do we make sure people feel comfortable in public space? The other type of data that we collected had to do with observational analysis. So we went out to 4 Danish cities using a digital platform that we've created, the Public Life data platform, that makes it really easy for people in different locations to collect data about what's happening in their streets and spaces through a standardized format. You can see some of the results here that I'm going to talk about at this website, covid19.gehlpeople.com, but I'll go through some of the highlights pretty quickly. So we looked at these 4 cities, very, medium-sized places, 50, 60,000 people populations, and then Copenhagen, the capital, 700,000, and found a few trends, right? Some snapshots of what was happening in Denmark in the middle of lockdown. This is all data from the 2nd and 3rd of April. We saw downtown areas largely deserted. We saw a lot more recreation, play, and exercise, which I'll come back to. We saw local places, so it is these pocket parks and schoolyards and local, even street corners, being actually seeing more use than before, more people spending time there than pre-COVID. We still saw, despite the world being turned upside down, some, like point number 6 here, just general essential human needs of searching for the shade, and if it's hot, or the sun if it's cold, protection from rain and wind. Hey, you know what? Even in a COVID world, those things are still important. And we saw new activities popping up and new user groups, which I'll talk more about. So 2 things I just want to emphasize here is this idea of local places. So outside the center of Copenhagen, in sort of adjacent neighborhoods, we saw either twice as much usage or 2.5 times as much usage, people spending time, people walking, than pre-COVID. So these two graphs are just the amount of people, the amount of activities happening in public space over time. You see throughout the course of the day on the x-axis, and the quantity of activities on the y-axis. So local life is thriving, and that's, I think, incredibly important lesson to think about going forward. Two other points that I want to really emphasize here is that we saw more exercise, we saw more play, more outdoor recreation happening than before COVID. So across these three cities in particular, you see the P here is play, amount of activities that were considered play before and during the lockdown in Copenhagen, the amount of exercise before and during the lockdown across these three cities, right? So strangely enough, in Horsens was the only city that we saw less play before than we did afterwards, and exercise went up in all the places. So this might be, again, familiar in the Danish context. I know this is different depending on where you are, but we saw a lot of kind of typical exercise happening, typical, play and physical activity happening, but at increased rates, but also new things popping up, right? So this is in the center of Copenhagen, where a lot of the shops were either closed or people weren't using them for shopping, and now all of a sudden kids had a chance to play football in places that they otherwise wouldn't. Skateboard here along the main walking street in Copenhagen, as it was empty of shoppers. It was a great place for skateboarders to hang out. With gyms being closed, we see a lot more yoga classes and exercise happening in parks. And I don't know if I'd call boule or patang actually physical activity, but still people getting out, exercising, getting fresh air, meeting one another, and other types of sports like that. So the other thing we saw is more children and elderly, actually, as a percentage of folks out in the public realm, and typically some sort of flip between men and women. So generally across the board, we see more females in public space than before, and we see some trends around how typically women would group in groups of 2 when they're outside, when they're in the public realm, whereas men would either be alone or in groups of 4 or 5. So again, another interesting sort of new type of behavior brought on by the pandemic. So as I mentioned, seeing kids in places like this where we usually wouldn't see them, using the public realm in new ways, skateboarding in the fountain, still playing music or hanging out in a new way, more of this patang. And I show this because this is typically more of these user groups of men and women, right? Going quickly because of time, but we know that Denmark was a special condition. We know that this wasn't the case in other cities. We would love to, get more of this data in more places. We did a little bit of this collection in New York and saw very different patterns there. So I think the question is, well, how do we use this information? Because now it's about reopening. So how do we gain insight into what's either changed or what's similar, who's there, who's not, to use an evidence-based approach, then to advocate for certain policies, to inform design decisions, to give city leaders hopefully some courage to make pretty bold decisions, because we know that saying that people can come out is not the same as really inviting them. So we have to invite people who are understandably scared to be outside, to be in streets and spaces, but also to do so in a responsible way. So very quickly, just a few themes for reopening strategies that we're still grappling with some of these questions. It'd be interesting in the discussion to discuss, issues about culture and cultural institutions. Music festivals, markets, gatherings are so important to city life. How do we reimagine them so they can still happen? How do we think about things like the retail sector or access to quality of the public realm? So many elements here that aren't directly related to physical activity, but certainly are part of the equation and hopefully can support one another. So for us, the key is to try to build upon some existing digital services to make it easier to collect some of this data and information, make it easier to equip decision makers with, hopefully, our idea here is to have some pretty often, collect some of this data and information at regular intervals, because things are changing very rapidly. Policies are changing, the way that things open up, people's perception of if things are safe or not is going to change. So we need to have hopefully some continued kind of monthly, bi-monthly registrations. This is what we're suggesting in some of the Danish cities and might be relevant for you all as well. So quickly wrapping up, how do we frame elements of public life and physical activity as not only being about health, but also vital for economic recovery? Can we manage physical distancing in a way that's healthy and responsible? Can we design strategies for moving indoor life outside? That's easy enough in the summer. What's going to happen more in the fall and in winter? And then, obviously, I didn't talk much about it here, but the hope is that we emerge from this crisis stronger than we were before. So lots of, I think, general questions, hopefully, and some data that provide some good food for thought, both for sort of the short-term design guidelines and the long-term change. And that's, I think I'm already over my time, so that's all for me.